Welcome to Adapting Class. If you can answer these 85 questions, you are ready for the NCLEX. I will explain not just the answers, but why the NCLEX wanted. 85 questions, NCLEX practice question arranged in systems from prioritization, cardiology, musculoskeletal, respiratory, neurology, everything you need for the NCLEX. Are you ready? Let's get to it. First question. For each question, I want you to stop the video, answer the question on your own, and then listen to the way I'm going to approach it. We're going to apply test-taking strategy. First question, which client should the nurse assess first? A nurse is caring for 4 clients. Number 1, a child with what? Ashburn disease presenting with explosive diarrhea and abdominal distension. Client with anorexia, BMI of 18, and cold intolerance. A client with Cushing syndrome, easy bruising, and leg edema. A client with hip fracture, leg pain when walking. As usual, this is prioritization. What do you see? How will you approach this question? Pause the video in a few seconds and answer the question, and then see the way I'm going to approach it. You pick your answer? Let's proceed. What do you think? How do you approach this prioritization? First, you have to know what the question is asking. What is the question actually asking? Who do you need to see so that they don't get into trouble? What do you need to do? Find the cue from each question. And as you've watched my video, you see how I call them buzzwords, and then connect them together. Ashburn disease, what is happening to them? Explosive diarrhea and abdominal distension. Is this something that you should worry about? Anorexia with the BMI and cold intolerance. Should you worry about this? Cushing syndrome, easy bruising and leg edema. Hip fracture, leg pain when walking. Those are the cues, and those are the things you need to do. Rewrite the question on your own. You pick your answer? I can tell you the correct answer is what? A. Why? Ashburn patients usually don't have explosive diarrhea. They usually cannot have bowel movement because of a constriction. The sphincter doesn't relax in the rectum, so they usually cannot have bowel movement. They have distension. Whenever they have explosive diarrhea and abdominal distension, it means they have enterocolitis. This is a big problem. They are in sepsis, and that's the right answer. Now, let's look at the other distractors that the NCLEX has put over there. Anorexia, what do you think? BMI of 18, cold intolerance, an expected finding, nothing to worry about. Cushing syndrome, what do you think? Easy bruising and leg edema, an expected finding, don't worry about it. If you have a hip fracture, this is a trap. You think it's a fracture, so you should deal with it. I said pain that will kill you. This kind of pain is not a problem. It's not fat embolism. And this is a trap. Leg pain when you're walking. If you have a hip fracture, when you walk, you're going to have pain. Therefore, this, you should not pick the answer. That is a trap. And therefore, to recap it, Ashburn, whenever they have explosive diarrhea, is an unexpected finding. That's the patient you see. First prioritization question. Second one, a nurse is caring for 4 clients with endocrine disorder. They all have endocrine problem. Which client should the nurse see first, right? Who should be seen first? Same strategy. A client with what? Hypothyroidism reporting fatigue and cold intolerance. Is this what you expect? A client with diabetes mellitus reporting what? Fruity smelling breath. What do you think? A client with Addison disease with salt craving. A client with hyperthyroidism reporting what? Tremor and heat intolerance. Once again, stop the video, pick your answer. That's the way to learn from this. I know you have your answer. Now, let me show you the cues. You have to find the buzzword for each question, and then we connect them together. Hypothyroidism, what do you expect? Fatigue, cold intolerance. Should you worry about it? Diabetes patient, they have fruity smelling. Is this what you see when you see diabetic patient? Addison disease, talking about salt craving. Is this what you think? Hyperthyroidism has tremor and intolerance. What do you think? Which answer choice you pick? What the NCLEX is asking you, what this question is actually asking you, who do you prioritize? Would you see an expected finding? Which one is dangerous? I can tell you the correct answer is number 2, because diabetic patient with fruity swelling is a ketone. When they form ketone, they are in DKA. So this patient is in DKA. That's the patient we're going to see. If that's the patient we're going to see, why are we not going to see number 1? Hypothyroidism, you're supposed to, everything goes down. So you have fatigue and cold intolerance. Addison disease, your sodium is very low and your potassium is very high. You need some salt. So they're going to have salt craving. And this is also NCLEX trap. So avoid it. Hyperthyroidism, tremor is an expected finding. They're going to have heat intolerance. Same thing. Therefore, our right answer is what? Number 2, diabetic patient with a fruity smell is usually in decay. Number 3, a nurse is caring for several clients with Alzheimer's disease. For clients, they all have Alzheimer's disease. What do you do? What will be your prioritization? Who do you see first? A client with Alzheimer's disease who is suddenly agitated and febrile. Number 1. Same thing, Alzheimer's, attempting to eat non-food objects, chewing things that are not food. Number 3, Alzheimer's who has stopped eating and drinking. What do you think? Alzheimer's who fell and is complaining about leg pain. Don't fall for the traps. Just focus on the keywords, rewrite the question, and what do you think? An Alzheimer's with agitation, Alzheimer's who is eating non-food object, Alzheimer's who stopped eating, Alzheimer's who fell and complained of leg pain. What do you think? If you're seeing this patient, what do you want to do? What's the NCLEX is asking you, who do you prioritize among all these patients with Alzheimer's? You pick your answer choice. I know you picked the right one. But I can tell you, number 1 is what? But I can tell you the right answer is this: being agitated and febrile. When they get agitated and febrile, it may be delirium. Delirium is deadly. It can kill this patient. You got to figure out what is causing the delirium. Of course, eating non-food object is bad. At the same time, stop eating. All this can cause dehydration, which is common. Malnutrition, common with Alzheimer's disease as they get closer to being very severe in nature. Yes, this is a trap. They fell. They complain of leg pain. Yeah, we're going to see them. But somebody who just agitated and febrile is a problem. We have to see number 1. That's our patient, because patient is going to be in trouble. And there's acute change in behavior. It's very, very serious when it comes to Alzheimer's patient. This patient may have a delirium. It may be caused by infection. If you don't figure it out, you'll really not do well. Physiological needs can wait, but this situation is very, very important. A nurse is caring for several clients with what? Mental health disorder. Which client should the nurse see first? What do you think? Who should be seen first? A client with anxiety reporting what? A client with anxiety requesting PRN medication. A client with schizophrenia reporting auditory hallucinations. A client with obsessive compulsive behavior is what? Washing hands repeatedly. And a client with depression stating, I won't be here tomorrow. If you're taking care of this patient, which one would you see? Which one do you think is in trouble? Which one is in, which one you think you need to see and fix the problem? Pause the video once again and figure out the answer, because you know the strategy. Then listen to me. But there's cues in the question. What are the cues? Let me point out. Anxiety patient is requesting medication. Schizophrenia has what? Auditory hallucination. Compare them. Those are the buzzwords. And somebody is washing their hands repeatedly. Why? Because they have obsessive compulsive behavior. And somebody said, I won't be here tomorrow, but I have depression. Which one do you think? Of course, the right answer is D, because that patient is in trouble. That patient, if you don't do anything, that patient is telling you, I'm going to commit suicide. And therefore, you should see that patient. If you don't see that patient will be dead. Of course, number B is worrisome. Auditory hallucination, you got to find the content of the hallucination. But the fact that this patient has passive suicide, that is still can be acted upon. He said, I won't be here tomorrow. Well, figure out what is going on. And therefore, D is the right answer, not B, because that's the trap. A and C are unexpected finding. So this patient, we have to see. A nurse is caring for several clients with what? Mental health disorder. Which client need immediate intervention? Same strategy. Which one? A maniac client talking rapidly and pacing. Is this what you expect in the patient with maniac? A client with PTSD experiencing flashback. Is this what you expect? A client with what? Panic disorder is what? Hyperventilating. A client with what? Schizophrenia, who is hearing voices that others do not hear. I do my prioritization by telling you, look, go for the buzzword and be sharp when you select the answer and forget about the unexpected finding. Which answer choice do you pick? Let me know in the comment section. But pick your answer choice before you proceed by pausing the video. I give you a few seconds. Now, a maniac patient, what do you expect from a maniac patient? I can tell you the right answer is what? Schizophrenia patient who is hearing voices, auditory hallucination, hearing voices. We got to find the content of whatever they're hearing, whether they're hearing something to kill themselves or kill the others. So that's the right answer. The wrong answers and the trappy ones, maniac patient, the definition of having maniac is talking really fast and pacing. PTSD is supposed to have flashback. And you have panic attack, you'll be what? Hyperventilating. Or a definition associated with the diagnosis. And therefore, the patient we should see is somebody who is having auditory hallucination. Therefore, we're going to see this. Number 6, a nurse is caring for several clients with GI disorders. Which client should the nurse assess first? A client with what? Good, reporting bloating and heartburn after doing what? Eating, okay? Client with Crohn's disease is reporting weakness and severe diarrhea. A client with cirrhosis who has what? Ascaris and fetus epithecus. What do you think? A client with IBS, what is he reporting? Bloating, alternating constipation, and diarrhea. Pause the video, select your answer, and proceed. I give you a few seconds to think about it. Did you select something? I know you select something. But now, let me show you what are the cues in each question. And the cues will help you to figure out whether this is an expected finding. And that's what I call buzzword. Underline them. Good. What are you saying? Bloating, heartburn when you eat. Okay. Crohn's disease. What do I expect? Weakness and severe diarrhea. Is that true? Cirrhosis. What? You have arthritis and what? Fetus epithecus. Is that what I expect? IBS. You have alternating constipation and diarrhea. This kind of prioritization is definition. They define the problem. And therefore, when you see it, don't freak out. I can tell you the right answer is what? C. Because if you have cirrhosis and I see cirrhosis, you have what? encephalopathy, hepatic encephalopathy. And fetus hepaticus, it's like you smell, master smell, like ammonia. Therefore, this patient is in hepatic encephalopathy due to ammonia buildup. When you have Crohn's, you're supposed to have diarrhea and weakness, expected. You're not dying from it. And reflux, hey, you're going to have bloating, heartburn when you eat. If you have IBS, the definition of IBS is what? Alternative, constipation, and diarrhea. All of them are trapped. They just give you definition, not the actual prioritization. This question is, who do you see first? You want to see somebody first in order to prevent them getting into rescue thinking, getting into the situation where you got to fix them right away, preventing them from getting harmed. That's risk reduction. And therefore, we're going to see this patient. Number 7, same thing, same strategy. And then she's caring for several clients with neuro disorder. Which client is the priority? Go through the same process, the mental thinking. We have somebody with ALS reporting what? Progressive weakness. Is this what you should see? Somebody with myasthenia gravis reporting dysarthria. Is this what you should worry about? I have trigeminal neuralgia and I'm reporting electric-like and stabbing pain in my face. And a client with neuropathy reporting numbness and tingling of both feet. What do you think? Pick an answer in the next few seconds that I'm going to give you to think about it. Did you pick one? Let me show you the cue. ALS is what? Progressive weakness. Myasthenia gravis, we are reporting dysarthria. Trigeminal neuralgia, I have electric-like stabbing in my face, pain, and I have neuropathy. I feel numb and tingling of my feet. Which one is expected and which one is dangerous? The right answer is number 2, because myasthenia gravis, when they have airway issue, it may be speech related. Dysarthria is related to speech. That means the bulbar muscles are weak, and therefore this patient needs to be seen. Which one are traps? Number 1, ALS. They're just supposed to have weakness, progressive weakness. It's not the problem. So far as they are not having airway, I'm not worried about it. I put the word severe there to trap you, but don't fall for it. Trigeminal neuralgia, what do you see? You see electric-like, shock, painful, stabbing pain in your face. This adjective is there to distract you. Don't fall for them. And neuropathy, what do you think? The definition of neuropathy is numbness and tingling of any part of the problem that is neuropathy. Expected finding. Therefore, our right answer is B. And as you can see, we're going through the same process using the same strategy to answer the question. Same thing. And nurse is preparing to administer potassium IV to a client with hypokalemia. Patient has hypokalemia. How do you administer potassium? Fundamentals, prioritization. Which action is essential for safe administration? What do you think? Potassium by IV push for rapid correction. Verify adequate urine output before giving them the administration of the potassium. Infuse potassium at 25 milliequivalent per hour through the peripheral IV. Add potassium chloride to a hanging IV bag at the bedside. Which action is the safest? You have to know safe medication administration of potassium. What do you do and how do you apply or administer it to the patient? Put down your answer and let me know. Or pick an answer and let me know later. What do you think? Which one do you pick? Pause the video as usual. Did you pick something? I can tell you the right answer is what? B, right? Why? Your kidney function should be appropriate before you give somebody potassium. Otherwise, if the kidney is affected, potassium go up and it causes cardiac arrhythmia. Why the other reasons are wrong. Potassium should never be given by IV push. Wrong answer. 2, infuse potassium through peripheral IV. Okay, but what is the problem? 60 milliequivalent every hour? Is that true? Think about it. And add potassium to a hanging IV bag at bedside. What do you think? Infuse potassium at 25 milliequivalent per hour through a peripheral IV. Potassium should never be infused more than 10 milliequivalent in an hour. Therefore, that's the wrong answer. You should not add potassium to any IV bag at bedside. That is wrong move. Therefore, number B is the right answer. These are safe medication administration you should master and should be familiar when you're giving potassium peripherally, 10 milliequivalent per hour. And you should never add potassium to any IV solution unless provided by the pharmacy. That is the wrong mode. This is the way you should go through the question. How are you doing so far? These are prioritization questions, and I know you're mastering them. Now, a nurse is caring for a client who presents with what? Muscle weakness, urinary retention, hypotension, bradycardia, diminished deep tender reflex. ECG shows prolonged PR interval and widened QRS. What do you think we've done? We've moved from prioritization to what? Fluid, electrolyte, and lab work. I want you to, in this video, I really want to get you to things that usually people try to stay away from. Giving you a bunch of signs and symptoms, and I want you to figure it out. A nurse is caring for a client who presents with muscle weakness, urinary retention, hypotension, bradycardia, diminished deep tendon reflex, and the ECG shows prolonged PR interval and widening QRS complex. The nurse should recognize the client is experiencing which electrolyte. And I give you a bunch of electrolyte. Hypocalcemia, hyperkalemia, hypermagnesemia, and what? Hypernatremia. Look at the client condition and figure out which one is causing that. That's all. What is your answer? I give you a few seconds to think about it. Which one would you pick? After you do that, let me break it down. And what is the question is basically asking you? Signs and symptoms of these electrolytes. How would they present? Okay, look at the situation, what is going on. Muscle weakness, things are going down. Urinary retention, things are going down. Hypotension, I'm going down. Bradycardia, I'm going down. Deep tendon reflex, I'm going down. ECG showing PR interval, signs of going down, and QRS going down. Hypernatremia does not do that. Hypocalcemia, when your calcium is low, your symptoms is supposed to go up. That is eliminated. Now you're left with this. You can say hyperkalemia, I'm supposed to see peak T wave. I don't see it, therefore eliminated. When I give you too much magnesium, it's like somebody receiving magnesium for what? Preeclampsia. Everything going down. Do you see that? This patient look like somebody who's having preeclampsia and receiving magnesium, and that's the things you should monitor. Yes, too much magnesium. That's our right answer. And nurse is assessing the client who has been receiving continuous IV infusion through peripheral IV in the left arm. The client report that the IV site felt what? Tight and uncomfortable. On assessment, the nurse note polar skin around the incision site, swelling, and pale skin. The IV pump alarm shows increased resistance. The nurse should recognize that the client is experiencing what? These are the diagnoses and what is caused by this. This is IV therapy. What do you think? Pick an answer. Do you think this is phlebitis, thrombosis, infection, infiltration? And if it's so, is it caused by bacteria? Is this caused by what? Slow infusion in the blood due to blood stasis, or prolonged what? Drilling of the IV in the catheter, or what? The IV dislodged from the vein. These are things you have to be comfortable with. Let's break the question down. Which one do you pick? I know you picked the right answer. Let's look at what is the problem. They said what? These are the cues you should focus on. And these are the ones you should use to break down the question. What do you see? Tightness. Tightness, number one, is uncomfortable. But then I see cold skin around the insertion site. There is swelling. It looks pale. And the IV pump is slowed down, right? Slowed down shows increased resistance. But all this thing, what is going on? Phlebitis, you should see palpable cord. There was no description of that. Infection, they will show warm, temperature going up. We don't see that. Thrombosis, it will be completely blocked. It's not. Therefore, this has to be what? Infiltration. And if it does the infiltration, it has to be due to what? Not due to infection, right? Not due to contamination, not due to stasis. It's because the IV has been dislodged. And that's what is causing the problem. How are you doing so far? 10 questions. What is your score? And how are you doing? Like I said, we're going through these 85 questions. They are very difficult, but they test the strategy, trying not to trap you. I'm breaking down the questions so that you can get comfortable when you see questions like that. How do you want to approach it? Same thing, a bunch of information. Don't run away from this question. Stay put. Say, I got it. Number 11. I'm going to read each line and figure out what they're asking me. And you see that when you know what is asking, the question becomes easy. And nurse is caring for a client with what? Severe burn over what? 40% of the body. 40% of the body is burned. 12 hours post-injury. What is the problem? These are the vitals. Blood pressure 88/52, heart rate 128, respiratory of 24. His lab, sodium 150 is too elevated. Hematocrit 55 is elevated. BUN 38 still elevated. Which action should the nurse take first? Do you give them IV fluid as prescribed? Do you let them drink some fluid? Do you call the air care provider for the high sodium? Or do you apply a warm blanket? Or do you apply a cool blanket? What do you think? What are you going to do? Which answer choice you pick? Few seconds to pick the answer. What did you pick? Guys, I can tell you the right answer is we got to give them fluid. This is a classic burn patient. It's showing you I'm in shock. 40% of the body injured and burned, and I have hypotension, tachycardia, my respiratory is going up, and I have signs of dehydration, high sodium, high hematocrit, high BUN. Those are all signs of dehydration. Therefore, I give you fluid. If I give you fluid, the traps, you can't drink fluid because your condition, you're in too shock. You can't drink it. You don't need to call for hyponatremia. It's because patient is dehydrated, fluid loss. And cooling them is not going to help. The most important, I'm in shock. Let me fix the shock. It's better to help me fix the shock. And nurse is reviewing a client's lab. Like I say, same thing. Which condition should the nurse suspect? This is the lab we've given you. Sodium, potassium, and blood pressure. I've given you reference range. Potassium is what? Too low. Sodium is high. Your blood pressure is high. What condition should do that? Is this SIDH? Is this hyperaldosteronism? Is this Addison disease? Is this diabetes insipidus? What do you think? This is the lab. Which condition will cause low potassium, high sodium, and your blood pressure is very high because your sodium is very high? What do you think? Did you pick an answer? I know you picked the right answer. SIDH is not going to do that. If this SIDH, I'll be talking about urine-specific gravity, osmolarity, and how much urine they avoiding. I never mention anything. Don't pick it because you see it's comfortable. At the same time, SIDH, sodium is going to be what? Low. Right answer is that. Why? Because sodium is high, potassium is low, and your blood pressure is high. Aldosterone increases your sodium, lower your potassium. Adenosine, potassium is supposed to be high and sodium is low. Therefore, it's wrong answer. Diabetes insipidus is all due to fluid. It can increase your sodium, but because of what? Losing clear water, not because of what? I'm getting rid of the sodium. I'm just losing pure water. Therefore, this is the right answer. And next is review lab results for a client with what? End-stage liver disease. There's certain lab values you're supposed to know based on liver function. Which findings should the nurse anticipate? Select and apply. If your liver is injured, should your AST go up? Should ALT go up? Should your albumin go up? Should your bilirubin go up? And should your platelet go up? Pick an answer. Let me know. I give you a few seconds. But put it down in the comments and let me know. Or just write it down on your own paper. But I can tell you, when your liver is injured, things that it does will be lacking. And if it's injured, anything associated with the liver goes up. Your AST goes up. It's associated with the liver. ALT goes up. It's associated with the liver. Bilirubin goes up, associated with the liver. Albumin, no. Albumin is made by the liver, and therefore it's supposed to go down. Platelets usually go down because there's portal hypertension. That means there's too much fluid going to the spleen. Blood is being diverted to the spleen because the liver is cirrhosis the spleen to get bigger, and you chew all your platelets. And therefore, platelet level is low. So you should expect AST elevated, ALT elevated, albumin down, bilirubin elevated, and the platelet down. An MS nurse is assigned to a cardiac unit for the day. Which client assignment is most appropriate? You can see we moved to delegation and assignment and some prioritization. Who should be assigned to the med-surg nurse in the cardiac unit? A post-op MI client receiving titration of what? IV medication and frequent cardiac monitoring. A newly admitted client with what? Chest pain and unknown history. A client with CHF requiring frequent IV diuretic adjustment. A client recovering from cabbage who need pulmonary toilet. It's an assignment question. You should not give the med-surg nurse anybody that is complicated, that is specific for the unit, that you need extra nurses to help with that. Give them something that is predictable, you can manage, and they're comfortable. What is your answer? Which one did you pick? I can tell you, we're going to pick 4 because that patient is stable. Pulmonary toilet is giving them incentive spirometer to improve their oxygenation and their lung function. But somebody who's requiring titrating IV medication and frequent cardiac monitoring is not safe for med-surg nurse. Patient who has chest pain with no figure out what is going on is not safe for the med-surg nurse. You have CHF requiring a lot of diuretic, you are not stable for a med-surg nurse. Therefore, this is the right answer. A nurse is floated from another unit to the pediatric unit. Once again, assignment has to be based on what the nurse can do specifically based on their specialty, not because of the floor. Who administer medication? Which client is most appropriate for the float nurse to care for? Who? 4-year-old asthma, scheduled for routine inhaler. 6-year-old with newly diagnosed type 1 diabetes who require insulin teaching. 3-year-old post-tonsillectomy with frequent vomiting and dehydration. 10-year-old newly admitted with seizures disorder and multiple new medication. Who is safe for a floater to the pediatric unit? Who do you think we should give to? It's the same strategy. I can tell you, number 1 is the right answer because it's easy. Asthma patient, inhaler is not in distress, probably has been in the hospital more than 24 hours, but we don't care. It's just scheduled for inhaler, routine inhaler, where I can give it. By a 6-year-old type 1 diabetes who require teaching, no, you want somebody who's done this multiple times. and that teaching has been assigned to some nurse who stationed to that unit. Frequent vomiting and swallowing for a patient tonsillectomy can be bleeding. And you have seizure disorder with multiple medication, I need somebody to be able to juggle through the medication, administer it to me, and if there's complication, can figure it out. So 1 is the right answer. And this is on the cardiac unit is planning care. Which tasks can be delegated to LPN? Now we have delegation. Who can do this? LPN can monitor most medication, reinforce teaching, but cannot provide initial teaching. All of this is acceptable, and surgical and certain medications they can administer. Performing a complex cardiac assessment, is that okay for LPN? Administer a prescribed intramuscular injection of a cardiac medication. Develop the client individual care plan, and performing discharge teaching on lifestyle modification. For teaching, you can just reinforce it. Developing a plan, you can do that. You can reinforce the plan. And what? IM medication injection is something that you can do. But completing a comprehensive cardiac assessment in this patient initially is not acceptable. How are you doing so far? I need to check on you. We're on delegation, assignment, and prioritization. You can see these are high yield things that shows up on the NCLEX. So master them. Like I said, 85. If you score really high, you're on your way past it, because these questions test your critical thinking. Which tasks are appropriate to delegate to the LPN? The same thing, you know the strategy. IV therapy for a new admission. The word new is completely eliminated, so don't give it to them. Conducting initial assessment. The word initial is not in the vocabulary of them. Therefore, that one is gone. Evaluating a client's response to a new pain medication. That's what the nurse has to do. Dressing change in the post-op patient is appropriate. Delegate to a UAP. What does the UAP does? Just ADL, assisting with the client, and then reporting whatever they see. They can assess, reinforce, teach anything. Teaching the client how to use a walker, where there's a teach there. Assisting a stable client with ambulation, ADL. Performing head-to-toe assessment on a post-op patient, head-to-toe, unaccepted. Head-to-toe, unacceptable. Administering oral medication, no, they cannot do that. Therefore, which one is ADL? Which one do you pick? You know, ambulation is the right answer. And this is caring for a client with what? Acute diverticulitis, prioritization, right? Which finding will require immediate follow-up? That means I got to do something right away. If I don't, the patient gets into trouble. Patient has left lower quadrant pain. Patient has fever. He has blood-like abdomen and constipation for 2 days. As you can see, I know you picked the right answer. So stop the video, pick one, and let me know. Which one did you pick? Prioritization 101. Who is in trouble? Left lower quadrant tenderness is what you expect in the patient with diverticulitis. Therefore, that's wrong. This is the problem. Diverticulitis is here. Therefore, here is fine. If you have an itis, you're going to have fever. That is not a priority. If you have blood-like abdominal rigidity, that means you have peritonitis. Constipation, well, there may be some obstruction. But what is the most important is this. Blood-like abdomen is peritonitis, and we got to do something about it. That's bad problem. Bad problem. Bad problem. How are you doing so far? 20 questions. I know you acing it. 21. And this is assigning tax for the day, which tax is appropriate for the LPN. The same thing. Forming initial assessment on a newly admitted client, administer a routine subcutaneous injection to a stable client, developing plan of care for a client with multiple comorbidity, performing discharge teaching for a client with diabetes. Initial assessment, negative. Plan of care, negative. Discharge teaching, negative. routine medication, they can do it. What do you see? Tell me in the comment. A bunch of cranial nerves, right? We've moved to neuro. If you are flowing from neurology, don't worry, I got you. These few questions is going to blow your mind. And it's going to let you think critically when you see neuro question. And next is assessing a client with sudden right-sided facial weakness, and drooping. You know, I focus everything on the face, not the body extremities. Therefore, which cranial nerve is most affected? You have to know the Roman numerals. Cranial nerve 2, cranial nerve 7, cranial nerve 5, and cranial nerve what? 11. What answer choice did you pick? I can tell you this is cranial nerve 7, right? This is facial nerve because this is classic Bell palsy. And the nurse need to be aware with it, right? And you got to provide some teaching. Cranial nerve 2 is not Bell palsy. Cranial nerve 5 is what? Trigeminal neuralgia, painful stimulation in your face. And cranial nerve 11 is accessory, help stretch out your shoulder. Therefore, that's your right answer. Have you seen this question before? You got it. I know you know it. What do you think? These are classic concept questions. And next is assessing a client in the ophthalmology clinic. Based on the image shown, which condition should the nurse what? Suspect. This is what you have. This is the normal vision when you have normal vision. But if you have this kind of vision, this is what you see right in the middle. You can see sides, but in the middle, you can't see anything. Is this retinal detachment? Is this glaucoma? Is this macular degeneration? And is cataract? What is the key? If it's retina, I'll use the word curtain falling under your eyes. There's no curtain falling on the imaging. Glaucoma, you're going to do what? Lose your peripheral. This patient has maintained their peripheral vision. Central vision is gone. That's why you have dot in the middle. Cataract does not affect this. It's just a lens problem. Therefore, this is macular degeneration. Watch it carefully. This is how macular degeneration is illustrated. And this is evaluating a client with what? Left cranial nerve 12, what? Palsy, hypoglossal palsy. Which finding should the nurse expect on assessment? Tongue deviation to the left when portrayed. Tongue deviation to the right when portrayed. Loss of sensation on the left side of the face. Drooling of the left eyelid. Which answer choice did you select? I can tell you the right answer is what? Look at it. Look at it carefully. It's A. Why? Why would D be A? Because if you, hypoglossal is responsible for what? Your tongue protrusion. If you push your tongue up and one side is weak, the tongue will deviate towards that because that side is not contracting. At the same time, if you use test-taking strategy, you know there's two answers that are saying opposite things. That means that should be your focus. C and D are unrelated. The A and B talking about the tongue, and both of them are talking about the tongue, but the key aspect is this opposite. One said deviate towards the side that is injured, another one said deviate away. You want to deviate towards the side that is injured because that side is weak. And next is assessing a client with suspected antithin disease. What do you know about antithin? This is the definition. Which of the following findings are consistent with that? It's a selected apply. You don't have to pick everything. There may be only one answer there. Be careful when you select. 1, involuntary jerky movement. 2, progressive memory loss and cognitive function. 3, hypothermia and rigid muscle. 4, personality changes, emotional liability. 4, tremor at rest. 5, young age and diagnosis. What do you know about antithin disease and how can you approach this question? Guys, I'll tell you, they're usually young. That's the problem. And the reason why they usually mind is because of memory loss, dementia in these young patients. They will have chorea, which is jerky movement. Hypertonia and rigid muscle is Parkinson's disease, different. They may have personality changes and liability because of what they're seeing. They don't have tremor at rest. That's Parkinson. And therefore, those are the right answer. The client reports a sudden severe headache around one eye that occur in recurrent episode lasting 30 to 90 minutes, often accompanied by tearing, nasal congestion, and redness and restlessness. Based on a clinical description, the client most likely experiencing what? Is this migraine headache? Is it cluster headache? Is it tension headache? Is it subarachnoid headache? What do you think, guys? Stop the video. Pick an answer. Let me know. Are you ready? Yes. This is the key. The first thing you have to pay attention to is the description of the headache. It's not the worst headache of my life. Therefore, our subarachnoid is gone. Do I see a photophobia? No. Migraine headache is gone. And you have a cluster and tension. Which one is tension? Which one is cluster? What do you think? The fact that we have a runny nose and tearing, we have a cluster headache. Tension headache will feel like a band around the whole head. Therefore, this is much better answer choice. I love this question because it tests your knowledge about stroke. This is what the NCLEX loves. This is things you should avoid. This is how they can put select and apply just to distract you. Look, a nurse has attended the staff education program on stroke. Which findings should the nurse expect in the client who is experiencing right-sided stroke? Select and apply. Left-sided hemiparesis, impulse control and poor judgment, speech aphasia, left-sided neglect, slow, cautious behavior. What do you think? If you are taking care of this patient, which assessment will you expect in the patient who has what? Stroke, right-sided stroke. Are you ready? Do you pick your answer? I know you pick it. Let's get to it. This is your brain. This is the left side. This is the right. The left side control the right side of your body, and the right side control the left side of the body. Therefore, if you have right-sided stroke, well, there's going to be left-sided hemiparesis because you're going to do what? Lose the ability to use the left side because you have right-sided stroke. So that's right. The key is the stroke on the right side. This is where the individual lose their impulse control. It's different from the left side. The left side are very very slow. Left side control speech. And the left side, what is going to happen? You're going to neglect your right side. And therefore, not neglecting your left-sided is associated with the right-sided stroke. And you're going to have impulse control. So those are the right answer you should be looking at. So what do you see? AB is the right answer, followed by D, left-sided hemiparesis, impulse control and poor judgment, and left-sided neglect. A nurse is caring for a client with long-standing myasthenia gravis receiving neostigmine. Which finding will be reported to the healthcare provider immediately? Ptosis, severe muscle weakness at night, bradycardia, and fatigue. What do you think? This is slightly pharmacology, but content associated with these neuro issue. Which answer choice do you pick? Now let's break down the question. I know you pick your answer already. Myasthenia gravis, they are weak throughout the day as it progresses, but they're strong during the morning. It's because they're using the acetylcholine. If I give you neostigmine, I'm trying to increase your acetylcholine. So you have too much acetylcholine. What would you do? It's going to cause what? Bradycardia is number one. Slows you down. That's the most important. You're going to have some fatigue. You're going to have some muscle weakness. But what is the problem? What is the problem? A, pitosis? No, that's not what you expect. You expect bradycardia associated with a bunch of acetylcholine. That's the key aspect of it. 29. A client present to the emergency department after trauma with hypotension, warm extremities, and what? Bradycardia. What do you think? Hypotension. I can't increase my blood pressure. But why would I be bradycardic? Because you're losing sympathetic tone. And then your extremities is getting warm because you're losing sympathetic tone from the fall. That means this patient is in what? Neurogenic shock. And that's why they behave in that. Warm extremities, hypotension, and bradycardia is neurogenic shock or spinal shock. These are very, very important IU content. The nurse is providing teaching to a client with mitral valve prolapse. With statement from a client with mitral valve prolapse indicate a need for further teaching. 1, I should limit fluid intake. I will avoid caffeine. I should continue taking my beta blocker even when I feel better. I will report chest pain and palpitation. What do you think? Pick your answer. I give you a few seconds to select your answer. If you're taking the NCLEX and you see this question, which one will you pick? Which one? I know you select an answer, but this is the cue. And what is the question is actually asking? It's the first thing you ask yourself. What is the question asking? It's asking what should indicate need for further teaching. That means they don't understand that when you have mitral valve prolapse, these are the things you want to do. Then look for the cue. That's the question. Now look for the cue. Should I limit fluid intake? Number 1. Should I avoid caffeine? Number 2. Should I continue taking my beta blocker even though I feel better? And if I have chest pain, should I report it? Those are your cues. Then you compare it to your content associated with mitral valve prolapse. What is mitral valve prolapse? Mitral valve prolapse is basically the valve that receives blood from your lung. And when it prolapses, you can have refluxes going back in the lung, and there's low what? A input to the heart. Basically, the preload is decreased. The right answer is therefore you should not limit your fluid intake. You should increase fluid intake to improve your preload. 2 is appropriate. You avoid caffeine to prevent tachycardia. C, you should not stop beta blocker because then you're going to get reflex tachycardia when you stop it abruptly. Of course, if you have chest pain, you should let the doctor know about it. Therefore, number 1 is the best answer. When you have mitral valve prolapse, you should what? Increase your fluid intake. You should not decrease your fluid intake. Hydration, increase preload, which decreases what? Mitral valve prolapse and related symptoms. You should not stop your beta blocker abruptly. What is the priority nursing action? What is the question asking? What you should do as a priority. Then you look at the question. A client admitted for what? Heart failure is on tele. The monitor shows new ventricular tachycardia at what grade? 160. And the patient is diaphoretic and dizzy, but still responsive. These are signs and symptoms they provided for you. What is the priority nursing action? Instruct the patient to bear down as if having a bowel movement. Prepare for synchronized cardioversion. Administer a dose of what? IV amiodarone as what? Prescribe. Continue monitoring and reassess in 5 minutes. This is cardiology, form of EKG. What do you think? Few seconds to select your answer, and then we break down the question, each portion by portion. What do you think? I know you select your answer. Then let's go and figure out what the question is actually asking. What is the question saying? Priority, nursing action. You got to do something. That means all the answer choices are right, but there's one that is going to kill the patient. Then what? A client admitted for heart failure. Patient has heart failure. And they shows on the EKG, they have what? New VTAC, ventricular tachycardia, right? At what? 160. That's the ventricular tachycardia, new ventricular tachycardia. You don't know if it's supraventricular or origin. They said ventricular tachycardia, 160, okay? Patient is diaphoretic and dizzy. That means the patient is having problem. Patient is having symptoms. That's your clue. So this question is just asking you, a ventricular tachycardia that is symptomatic, what do you do? I can tell you the right answer is what? Synchronized cardioversion, because the patient is having symptoms, is unstable. Why is the other answers are wrong? If you let the patient bed down, you are suspecting that this is supraventricular tachycardia. The question never says supraventricular tachycardia. At the same time, a symptomatic supraventricular tachycardia should get what? Treatment, not bed down. Bed down is the first thing you do. At least need some medication. Administer amiodarone. You're suspecting this is ventricular tachycardia, true ventricular tachycardia. The patient has symptoms, therefore this is also wrong. You should not continue to monitor. And as you can see, the take-home question from this NCLEX question is what? When you have ventricular tachycardia and the patient is symptomatic, what you do? Synchronize cardioversion. And that's the strategy to answer the question. A nurse is assessing an unresponsive 10-month-old child, infant, and note no breathing, unresponsive and no breathing. Which action is most appropriate? Check the cardiac pulse for 10 seconds, begin chest compression, open the airway and give 2 rescue breaths, activate the emergency response system, and obtain an EED. As usual, stop the video, pick your answer. I give you a few seconds to do that. You select an answer? Okay, now let's break down the question. Let's figure out what the question is asking. What are the cues to answer the question? You go back to the stem of the question, and then you figure out most appropriate. That means this can be all okay. We have unresponsive, no responsiveness, 10-month-old, it's an infant, and it's not breathing. What would you do? Cardiac pulses is appropriate for a 10-month-old, even though the 10 seconds is okay. Should you begin with chest compression or give rescue breath and then activate the emergency system? What do you think? I can tell you the right answer is give them rescue breath, right? The patient is unresponsive, is not breathing. They do not tell you about pulse or anything like that. But for pediatric, the most common cause of cardiac arrest is what? What do you think? It's what? Respiratory problem. So this patient, you need to give them rescue breath. If they don't do anything, then you can check you can start your chest compression. So this is very, very important. It's unresponsive and it's not breathing. It's 10-month-old. The most common cause is a respiratory problem. So give them a rescue breath. And at the same time, cardiac pulse is not appropriate for the infant. You're going to use what? Brachial pulse. That's where you're going to check it. Then after you've done all, before you can activate the emergency response system. So this patient gets rescue breath. The infant, the nurse you assess breathing, then pause. If the infant is not breathing, then you present with the pause. This is the way you should progress. Infant is a little bit different. Always their major problem is what? Respiratory before cardiac. So assess the cardiac function first before you do anything. A nurse is assessing an unresponsive 10-month-old and no breathing. Which pulse site should the nurse assess? This is just to reinforce the content we've learned. I told you, if you want to assess for the pulse in an infant, what is the best place? It's not the carotid, it's not the femoral, it's not the radial, it's mostly brachial. Just note that. This is very important. Carotid for adult, that's the most common place before you go to the femoral, right? Or the radial. But this is the most important for kid. It's what? Brachial pulse. Which of the following finding would be most consistent with this condition? A new graduate nurse is caring for a client with what? Peripheral arterial disease. Which of the following finding would be most consistent with this condition? Thick brown skin of the lower extremities, class 3 edema of the lower extremities, toe ulcers, warm lower extremities. Pause the video and let me give you some few minutes, few seconds to answer the question. You pick an answer? Let me tell you what the question is asking now. All the question is asking you is, what do you see when you see somebody with PAD? And what content you need? PAD, less blood flow to your leg. Therefore, I should see some form of ischemia. Let's look at a cue from each question and see which one is wrong. A thick brown skin in the lower extremity, is that appropriate for PAD? Edema, do you see that in PAD? Toe ulcers, do you see that in PAD? Warm lower extremities, do you see it? If I have less blood flow, what do you think will shows up? I can tell you the right answer is what? C, because the toe is where less blood go, and therefore that's where you're going to get ulcers. Why? The other answers are wrong. If you have too much blood going to your leg, right, that is what? PVD, and that will lead to what? Thick browning skin from breakdown of what? Hemoglobin from blood. Therefore, this is PVD. If there's too much blood going to your leg, you see edema in PVD. If there's too much blood going to your leg, you see warm lower extremities. So 1, 2, and 4 are all PVD. The only thing that is PAD is toe ulcers. That's the way you break down the question. You can see this become easy when you're analyzing it without no memorizing. Which task is most appropriate for LPN to perform? This is a cardiac patient, but this is a form of delegation. A nursing team consists of a registered nurse, licensed practical nurse, and a UAP is caring for a client identified with what? Acute myocardial infarct. Which task is most appropriate for LPN to perform? IV nitro titration based on the chest pain, perform initial assessment of the chest pain, administer oral medication and monitor vital signs, interpret ECG changes and notify the provider. What do you think? Who is stable? Which task is stable for the LPN to do? Which task do you think is the most appropriate for LPN? I give you a few seconds to think about it and select your answer. Lock in your answer. Now, what do you think? What is the question is asking? Which task is appropriate for LPN? What can the LPN do? They shouldn't do any initial assessments. Therefore, this is gone, right? They should not deal with what? They should not deal with, they are not allowed for high maintenance medication. This is too much, titration. Oral medication is appropriate. This is what they can do. They cannot interpret the ECG right now. So this is inappropriate. The right answer is C. And you can see, if you break it down, the questions become very manageable. Which assessment finding is the priority? That means all the answer choices are right. And this is caring for a client with what? CHF will report 5-pound weight gain over 3 days. That's not good. Exacerbation, right? What should be your priority? Crackles in the lung, jugular vein distension when upright, plus 2-leg edema, and blood pressure of 140/80. What do you pick? Which answer choice is yours? Select your answer. Lock in as usual. It's going to be the same. I'm going to repeat it so that you can lock in your answer. I want you to pick your answer choice first. Now, let me break down the question so that you can figure out what is going on. We have CHF, 5-pound weight gain. All it's asking you is exacerbation. Therefore, we're dealing with exacerbation. Exacerbation, the most priority is your lung function. That's all. Crackles should be your right answer because I have the lung function. Patient has pulmonary edema. JVD, when you're upright, because of fluid overloaded, you're going to have JVD. If you have fluid overloaded, you're going to see +2 edema. And your blood pressure is normal. You're not going to worry about it. Therefore, our right answer is what? 1. And what is the takeaway question information from the NCLEX? Any weight gain in a very short time is going to cause you to have CHF. If you have CHF, you go into exacerbation. What should be your priority is pulmonary symptoms. Patient has pulmonary symptoms, that means they have pulmonary edema. Which statement best describe what was done? This is MSK. We've moved from cardiology to what? Musculoskeletal. These musculoskeletal are very high yield, sometimes very fewly taught, and these questions are designed to test your mind. This is the most testable portion of the NCLEX if they're going to ask you questions on MSK. So let's get to it. Which statement best describe what was done? About what? A client underwent open reduction internal fixation for fracture. A metal rod was inserted into the bone marrow cavity. A bone grafting was performed. Bone was manually realigned without surgery. The fracture was surgically explored, realigned, and stabilized with hardware. Stop the video. Pick your right answer. Now, let's figure out what the question is asking, what are the cues for the question, and what is the correct answer. First, rewrite the question on your own and figure out what is asking. All he's asking you is what? What is the definition of open reduction internal fixation? That's all. And what is the cue in the answer choice that should stay away from? He said metal rod was inserted. We inserted metal rod into the bone marrow. This one said we use a bone graft perform. This one we just manually align with that surgery. And this one said we surgically exposed to realign and stabilize the hardware. Which one described in totality of what was done? The word said open. That means I have to open something and I have to reduce it and I have to internally fix the problem. The right answer is D. It's talking about everything. The fracture was surgically exposed. That is the open portion of it. Realign, put it together, and stabilize it with what? An hardware. That is what internal fixation is. You can see C is wrong because it said without surgery, manually realign is basically you stabilizing the joint that is broken or the bone that is broken, splinting it. You're performing bone graft. That's not what it said. It said internal fixation. Metal rod was inserted in the bone marrow. No, that's not what it said. And therefore, D is the right answer. You can see how these questions are usually straightforward, but that's the key. You always have to go with the concept. Which nursing action should the nurse perform first? What is it asking? Priority. A nurse is caring for a client with newly applied long leg plaster cast after tibial fracture. What is asking? What is the buzzword? Long leg plaster cast. The key question is about plaster cast. What should you perform first? Elevate the leg above the heart after patient's leg plaster cast. Handle the cast with your fingertips. Assess for color, warmth, movement, sensation of the toes, and encourage ambulation. Which answer choice do you lock in? I know you picked the right answer, but the question is, what do you do first? Prioritization. Every time you see first, that means all the answer choices are right. But which one should I prioritize, right? If I don't do that, patient gets into trouble. About what? Patient has newly applied long leg cast for the tibia because they are fractured. What should be your priority? What is going to cause the problem? Elevating the leg above the heart, level of the heart, there's going to be less blood flow. Under the cast with fingertips, you're going to cause compression of the cast. Assess color, warmth, and sensation. You're trying to figure out if they have compartment syndrome. You want them to walk right away? I don't think so. And you can see the right answer is assessment for color, warmth, movement, and sensation of the toe because you worry about compartment syndrome. A nurse is caring for a client diagnosed with what? Osteoarthritis. Which findings should the nurse expect? Bilateral finger stiffness and joint swelling. Morning stiffness relieved by rest. Positive rheumatoid factor. Asymmetrical joint pain that worsens with activity. Guys, pick your answer. This is musculoskeletal for nursing and NCLEX questions. Which one would you pick? I know you picked the right answer. What is the right answer? Think about it. Go for the content associated with this. And the right answer is what? Which one you think? Asymmetrical joint that worsen with activity. Why? Because that's what you see in what? Osteoarthritis. The question is asking about osteoarthritis and what should you expect? Expected finding. So rewrite the question and say, expected finding on osteoarthritis. I see osteoarthritis. I know one joint is involved, asymmetrical, one. If they move the leg, it's going to what? Be painful because of the what? The joint is either there is no space between the two joints, the bone, and therefore it touches each other. It's wear and tear. So the more you use it, the more you get into trouble, the more you have pain. Therefore, when they walk, they are more likely to have pain. Rather than rheumatoid arthritis, when they walk, the pain get better because when they don't walk, they have stiffness. Positive rheumatoid factor is consistent with rheumatoid arthritis. Bilateral finger stiffness and joint swelling, like I said, rheumatoid arthritis has bilateral extremities, osteoarthritis as what? Unilateral, asymmetrical. So this is the right answer. Which client is the most appropriate candidate for gallows traction? This is a content question. You just have to know basic fact about what gallows traction. And nurse in the pediatric unit is caring for several clients. Which one is most appropriate for gallows traction? A 7-year-old with what? Displaced femur fracture. A 4-year-old with fractured tibia requiring skin traction. A 12-month-old infant with femoral shaft fracture weighing less than 30 pounds. And a 10-year-old with a pelvic fracture requiring skeletal traction. If you know it, I want you to pick the right answer. But I need to give you the content is straightforward so you can use it and write it down. I want you to stop the video and then write this concept down. When you see the word gallows traction, this is the 3 things that should come to your mind. If you know that, the answer choice will become easy. The question is asking about gallows traction and what is the NCLEX want you to know. You have to be less than 2 years. Write the first thing down. You should weigh less than 30 pounds, right? And it should be involving like a femur fracture. So which patient meet all these criteria, right? I see a femur shaft fracture. That's my right answer. I weigh less than 30 pounds. That's my right answer. And I'm less than 2 years old, right? 7 years old. Even if you don't know, displace it. You take it away. 2 years old. I don't know the rest, but I know you have to be less than 2 years old. 10 years old. I know you have to be less than what? 2 years old. This is the way you answer question. You know the fact, you don't even care about the rest of the thing. It has to be less than 2 years old. And the rest are all less than more than 2 years old. The only one who is less than 2 years old is that one. Which of the following interventions should the nurse prioritize during a hospital stay to prevent further complication? What is the problem? A client with osteoporosis is admitted after a fall resulting in what? Left hip fracture. Which of the following interventions should the nurse prioritize during a hospital stay to prevent further complication? Administer high calcium diet and vitamin D supplement. Encourage ambulation and regular physical activity as soon as possible. Implement 4 precaution measures and provide bedside command. Schedule her for immediate DEXA scan. That's all. Which answer choice will you pick? Go for the keyword in the question. Stop the video, go for the keyword in the question, and use it to answer the question. Did you lock in your answer choice? This is where the question is asking you. I have a patient who has what? Osteoporosis, right? And he's being admitted to the hospital. He has a hip fracture. What should you prioritize? That's all. You know a patient has hip fracture, and a patient has osteoporosis. It's more likely to have more fall. Therefore, what should I prioritize? The right answer is to prevent more fall. This because this is going to cause problem. They already have fracture. They have osteoporosis. You don't want them to fall anymore. And that's the right answer. Why this is wrong? This is the diagnosis of osteoporosis. We already know. How is that going to help you? The question says to prevent further. This is not going to prevent further. That's the cue. Encourage ambulating and regular exercise. They already have a fracture. They need some help. We don't need that. High calcium is not going to prevent further fracture or complication. We want to prevent them from falling and causing further complication. So our right answer is that. Which finding require priority action? That means something is bad and you got to figure it out. And this is caring for 8 years old who is post-operative open right femur reduction with cast placement. Two things happen. Femur was reduced and they placed a cast, right? That is like splinting it. Reduction and placing a cast. Which finding you should worry about? Capillary refill, 3 seconds on the affected extremities, blood stain on the cast, warm toe of the affected extremities, asking for pain medication every hour. This is a high-yield question, require critical thinking. Stop the video and pick your answer. But the main thing to answer the question is figure out what you should worry about most. Did you lock in your answer? I know you did. Now, let's break down the question and why the right answer is what it is. The question says post-op, so had surgery, required open right femur reduction. That means they cut the patient, they fix the femur fracture because it's open, right? And then they placed a cast, like a splint. So open reduction, internal fixation, but after that, they placed the cast. What should you worry about? Capillary refill 3 seconds, is that what you expect in this patient? Is that worrisome? Is that normal? Should you see a blood stain on the cast? Should you see a warm toe of the affected extremities? If the patient is asking pain every hour, should that be your concern? Asking for pain every hour is our priority. This is compartment syndrome. This is the right answer. Why? Because it's early signs of compartment syndrome. That means nothing is happening. Warm toes, I mean blood is going there. That's good. If I have an incision and I have a dressing, some blood stain is going to be on it. That's not good. Bad. Capillary refill less than what? Or 3 seconds of the affected extremities is really normal, right? 2.3 seconds, 2 to 3 seconds is usually normal. If I said it's more than, yeah, that's the problem. This is just 3 seconds. It's really normal range. If it takes a longer time to feel capillary refill, that means there's less blood flow. But 3 seconds is really normal range. Therefore, D, asking for multiple medication because they probably is having compartment syndrome. What should you take away from this question? Every time the NCLEX asks you about cast, number one thing you should worry about is compartment syndrome. So that's the thing. Pay attention. That's the takeaway for this question. Which finding the nurse know is consistent with the spiker cast? You have to know something about spiker cast. The nurse has attended staff education about on cast. Which one is consistent with spiker cast? A cast applied from the area below the knee to the foot. A cast applied from the chest to the thigh or knees. A cast applied from the fingers to the elbow, and a cast applied to the chest and the neck. This one is content, recall, memorization. That's what the question is asking you. They say certain questions you see on the NCLEX, they just want you to know what it is. You don't have to worry about pathophysiology, anything. What is the spiker cast? That's all. So I'm going to give it to you straightforward. The right answer is that. Is a cast that is like a whole body cast, right? From the chest to the knee. That's almost the whole body. Below the knee to the leg is not a spiker cast. On your fingers, it's not. And in the chest to the neck, it's not. Therefore, these are very classic. It's used for alignment if you have certain injury. And this is very helpful, especially if you have young kids, if they have the hip dysplasia. These are the things we use for them. So know the content associated with that. Like I said, there's some recall questions you have to know. If not, these are the things you have to pay attention and write them down. Which of the following actions should the nurse take? Select and apply. A nurse is in emergency room is caring for a client who sustained a fracture. Patient had a fracture. What would you do? Elevate the affected limb, assess neurovascular check frequently, stabilize the injury, palpate the injured area to elicit crepitus, place a cold pack on the site of the injury no longer than 20 minutes at a time. Provide prescribed pain medication. It's a select or apply. Don't over-select. Don't pick too much. If you know two, pick it. After you select it, move on. Don't be greedy. Which one do you pick? Which answer choice? I can tell you, we can break down each answer choice and then we can figure out. Elevate the affected limb. Yes, to help with the edema. Assess neurovascular check frequently. It's good so that we know blood flow is going there. Stabilize the injury to prevent it from having more pain. If you stabilize it, you splint it, it usually causes less pain. Palpate the injured area to elicit crepitus. Why do you want to palpate a fracture that you know is fractured? When you do that, you're causing more pain. Don't do that. A cold pack should be applied, but no longer time. So this is okay. And of course, patient has pain, provide prescription. These are little things I'm just putting there so that you can understand things the NCLEX will ask you. Which position should the nurse place the client, right? You can see we've moved. This is now what? Respiratory. Respiratory, nursing, respiratory for NCLEX. These are high yield content, so pay attention. Take your pen and paper. If you're tired, go take a break and come back because respiratory is key. You better stay around for these high yield concepts. Which position should the nurse place the client? A nurse is caring for a client who has what? Just returned from what? Thoracentesis. Supine with the head of the bed flat, side laying on the affected side, side laying on the unaffected side, Trandelabel position. I know you're locking your answer. Then let's break down the question. Then go for the cue. Always go for the cue so that you know what, and rewrite this. Describe the question again. I had thoracentesis. What position will you put me? That's all. And then you tell yourself, this is the lung, right? And then I puncture this side. This lung is fine. I got to give this lung time. Therefore, place the client on the unaffected side. Now, the another one to answer the question is what? What do you think? There's a clue. You can see this is saying place them on the affected side, and this is saying unaffected side. If you have opposite answers, this one and that one is wrong. Therefore, it has to be this. You have 50-50 chance of answering the question. That's the best way to approach negative answers. They are opposite. One of them have to be right. And if I puncture your lung, I should let the lung recover. So that lung should go up. So that's why you can pick the answer choice, even if you don't know the content, by using that. Affected side should go up. Which findings are consistent with obstructive sleep apnea? Key concept, key NCLEX favorite. So watch this and know the content. Loud snoring, morning headache, daytime sleepiness, bradycardia during sleep, and witness apneic episode. Selected, apply. You don't want to over-select. If you know it, I want you to pick all of them. Right? If you don't, just leave it alone. Pick those that you're confident. Make sure it makes sense to the problem. Sleep apnea, they're going to have loud snoring. They don't sleep at night. Therefore, they have morning headaches. Right? They have what? Daytime sleepiness because they can sleep during the night. Sleeping, when they wake up, their heart rate goes up because of the apnea. Then somebody is going to see the apneic episode, usually the spouse, so witness that. Yeah. These are concepts the NCLEX usually love, but you can use the content associated with it based on the name to figure out what is going on with them. Which breath sound should the nurse expect to hear over most of the lung field? A nurse is performing a respiratory assessment on the healthy adult. Bronchial, vesicular, adventitial, bronchiovesicular. Straightforward question by high yield fundamentals, respiratory fundamental. Very, very important. I want you to lock in your answer. Then I will show you strategy to figure out the right answer. You lock in your answer. Let's look at it. What the question is asking. It said what? Breath sound, right? Over what? Most lung fields. The overall, every area. The right answer is vesicular. Vesicular is usually overall, you hear it overall the lung fields. That is the most common. Then let's look at the others. I see brachial. Oh, it has to be something along the brachial. Adventitious is abnormal sound when you hear it, when you have fluid in your lung, all the wheezing and other thing, they are adventitious lung sound. And this one I see bronchial and vesicular. Oh, it has to be the bronchial and the vesicular portion and the lung fields, both. You see the strategy? The name give it away. The name give it away. Therefore, pay attention. This one you hear near the bronchial with the vesicular portion of it, the bronchial, some bronchial portion in the tracheal area, and the vesicular along the most lung fields, and this one when it's diseased. So that's the way you should approach this question. And this is the description of that. Bronchial, carried over most areas in the trachea, bronchivesicular, upper main bronchial, and then adventitious, there are abdominal sounds. So crackles and wheezing are very common. Which statement by the client indicate need for further teaching? They're saying the wrong thing. A client with the history of smoking is diagnosed with what? Emphysema. The nurse teaches the client about what? Energy conservation. How do you conserve energy? What do you teach COPD patient to restore their energy? I will schedule rest period throughout the day, especially after meal, right? Meal need energy. Therefore, throughout the day, I need to schedule some break period to rest. I will increase my fluid intake at least 3 liters per day. Is that what they should do? I will pace myself throughout the day and avoid strenuous activity. I will use your wheel cart to transport items instead of carrying them. Locking your answer. Let me know what they should do. Which one need further teaching? What do you think? The right answer is that, right? This need further teaching. This is inappropriate. Excessive fluid intake will cause distension, will affect what? Your lung function. In the process, emphysema does not have what? Mucus. So they don't need to break down their mucus. This is going to affect them. But scheduling rest period throughout the day is a good thing. Pacing yourself is also a good thing. And not carrying heavy stuff is a good thing. All of them will conserve your energy. B is inappropriate because this can affect too much function. When you drink too much, this is a big problem for them. Energy conservation is based on rest, pacing, and minimizing exertion. Appropriate function. Which order should the nurse expect? What do you think? A nurse is awaiting orders from a healthcare provider for a client with what? Acute asthma. Patient has an asthma. What should you expect? Salbutamol, ipatropine, theophylline, high flow oxygen. Theophylline, prednisone, Metallucas, high flow oxygen. Salbutamol, ipatropine, prednisone, high flow oxygen. Prednisone, terbutaline, Metallucas, high flow oxygen. Pharmacology, asthma pharmacology. Do you lock in your answer? Let me know. This is asthma pharmacology, respiratory pathology. What do you think? I know you picked the right answer. I give you a few seconds more to pick an answer because I want you to get this right. Get this one right. Stop the video, pause it, and get this one right. Now, let's break down the question. What is actually the question is asking? Straightforward. Acute asthma exacerbation. What medication should you expect? Rewrite it. Then you tell yourself, acute. That means I have to use something to treat the patient right away. No long-acting medication. That's all. The right answer is what? C. Why? Salbutamol is similar to albuterol. It's a short-acting. Ipatropine, it's a short-acting. This is anticholinergic. Prednisone is going to help with that and high-flow oxygen. The rest, if I see a long-term medication, I eliminate it. Theophylline, long-term medication. Metallucas, long-term medication. He also has theophylline. I see terbutaline, it's a long-term. Metallucas, long-term. You can see the rest is history. You pick the right answer. It's a very complicated question, but In actual fact, I'm asking you acute asthma treatment and what medication you should use. Anything that is long-term, eliminated and move on. Therefore, that's gone. That's the explanation. Which of the following findings support the diagnosis? Once again, respiratory nursing is a little bit difficult, but I got you. These are questions that will help you think about it. I'm going through abroad. We did pharmacology, emphysema, COPD. Now we have sarcoidosis. Have you heard about it? And this is caring for a client diagnosed with sarcoidosis. Which of the following findings support the diagnosis? Select or apply. Bilateral hilar lymphadenopathy, productive cough, hypocalcemia, fatigue, and erythema nodosa. If you've never heard about it, I want you to pause the video, still select an answer. If this is what you saw in your NCLEX, pick something. But think about the answer choice before you pick it. You select your answers? Yes. Now, let's break it down. Content, take your pen and paper and write it down. Sarcoidosis is a condition that can affect lymph node, skin, and certain organs like your lung. Lymph node, when you affect lymph node, when you look at it in your chest, you're going to have bilateral hilar lymphadenopathy. That means if this is the trachea and the lung is here, you're going to have a bunch of lymph nodes all over here. On the chest X-ray, that's what you see. Their cough is not productive. That's the key. This is very, very important. They're not going to have productive cough. It's not an infection, right? It's not an infection, so they don't have productive cough. This is to trap you. So write all these signs and symptoms down. They are going to have high calcium because they form granuloma. Granuloma, like certain things like TB, right? They form granuloma tissue and they releases a bunch of calcium from it. So they have high calcium. Write it down. They're going to get tired. This is expected. And on their skin, you're going to see erythema nodosa. I told you there's a skin manifestation. So NCLEX, we're not going to trap you and give you wrong skin. I just give you what you should expect on that patient. So the right answer is ADE. Therefore, I want you to write it down again. And the concept associated with this condition is what? Bilateral hilar lymphadenopathy. They're going to have a non-productive cough. Their calcium is going to be elevated. They're going to have fatigue, and they're going to have erythema nodosa. So that's the concept associated with it. These are all signs and symptoms. I want you to take a picture of it and then learn them. Now, this respiratory, it looks busy, but it's not difficult. Don't worry. When you see questions like that, don't be defeated. Just take it. You say, no, I know this. It's a picture presentation of concept. Let's break it down. Reviewing diagnostic test for clients with respiratory disease. Match the appropriate test with each condition. I have TB, sarcoidosis, small cell lung cancer, chronic obstructive pulmonary disease. What do you think? Which one need PFT? Which one need chest CT, biopsy, cytology? Which one needs serum ACE? Which one need angiotensin converting enzyme level and hilar lymphadenopathy? Which one need what? Acid fast smear. Pair your answer choice and let's break it down. Which one you think? Pair them. You get your answer? You log them in? Good. TB, you know you're going to get acid fast. If you have COPD, you do pulmonary function test. And you left with this. I told you sarcoidosis, hilar lymphadenopathy. Even if you don't know, if you have cancer, you should get a CT of the chest and biopsy it. So this is the pairing. Write it down. Take a picture of it. Know how to do diagnosis test for this condition. What should the nurse do next? Prioritization, right? A nurse is caring for a client diagnosed with pneumonia. Patient has pneumonia. The nurse note that the respiratory rate is 25 breaths per minute. What would you do? Prioritization. You got to know, I see the condition. Patient is going to get sick. What should I do? Should I just ignore it? Should I report it? Should I do more? Administer oxygen via nasal cannula. Encourage the client to use the incentives perimeter. Obtain vitals. Notify the air care provider. Guys, I want you to pick your answer because this is the test-taking strategy. You see these questions more. If you want to know how to do prioritization, this is one of these questions. What did you know? Answer choice do you pick? I hope you pick obtain virus. Patient condition is worsening. Respiratory rate is gone up. He has pneumonia. Well, I got to know. Respiratory rate is not enough. What is the saturation? What is the heart rate? What is the temperature? How does the patient look? So, and how does the patient have pain? Get more vitals. Treating the oxygen with oxygen is not appropriate. You're just treating the vital sign. No. Encouraging the client to take his spirometer. You don't even know saturation. I give you respiratory rate. Letting the doctor know you don't do anything. Therefore, obtain more vitals. That's the right answer. You need to figure out what is the perform full respiratory assessment in addition to vital signs to figure out why the patient respiratory is going up. Then you can report it to the doctor. And then attend a staff education program about tracheostomy care. This question can be very difficult. So I want you to stop the video, select which one you want, then we break down the content. And whatever content we write down, don't forget it. Put it part of your notes. Which statement indicate the nurse correctly understand the teaching, select or apply. I will suction the tracheostomy only when secretion are present. I will change the inner cannula according to the facility protocol. I will deflate the cuff of a cuffed tracheostomy tube while the patient is on a ventilator. I will ensure the client always has oxygen tubing connected to the tracheostomy. I will keep a spare tracheostomy tube of the same size at the bedside. I will reinsert a dislodged tracheostomy immediately if displaced within 7 days. Select and apply. It's about tracheostomy care. Which answer choice jump onto you? And they said, hey, this is correct answer. Pick yours, lock them down, and let's break it down. But which one is jumping at you, telling you something is wrong? What do you think? One, let's break down the question. Tracheostomy care, there's certain things you should do. I will suction the tracheostomy only when secretion are present. Yeah, you should not suction the patient all the time. They shouldn't be scared of. If they have issue, you suction them. So correct understanding. I will change the inner cannula according to what? The facility protocol. If that's what they want me to do, I'm going to do it. Does that make sense? I will deflate the cuff of a cuffed tracheostomy tube while the patient is on the ventilator. That will cause problem. The tracheostomy will fall. You shouldn't deflate. The reason why it's a cuff, you should keep it cuffed. I will ensure the client always has oxygen tubing connected to the tracheostomy. Just because I have tracheostomy doesn't mean I need oxygen every minute, right? If I don't need oxygen, the tracheostomy is giving you access to the neck in case they have respiratory problem. But if they don't need oxygen, they can breathe normally. Hey, and your oxygen saturation is 100%. Why do you give them oxygen? I will keep a spare tracheostomy tube of the same size at the bedside in case the other one fall off. So that's good. I will reinsert a dislodged tracheostomy immediately if placed within 7 days. So if the tracheostomy is placed within 7 days and it dislodged, should you reinsert it? No. 7 days is your mark. If it's less than 7 days, never put it back. If greater than 7 days, yes, the tract is developed, so you can reinsert it. But less than 7 days, never put it back. So that's wrong. So these are what indicate correct understanding of the trachea. If you have issue, I want you to play this portion multiple times. And when they give you a tracheostomy question, you will never forget. This can be a full video. I just give you everything associated with trachea. And then provide care for a client with tracheostomy who needs suction. This is based on the previous question to give you all the content. Which action the nurse should take first? If I need suction, what insert the suction without pre-oxygenation? Pre-oxygenate with 100% oxygen. Suction client mouth. Ask client to take a deep breath for 10 seconds. This one is a straightforward. Just want you to know certain content regarding suctioning of tracheostomy. You should never suction the patient without pre-oxygenation. Therefore, the right answer is B. I put the pre-oxygenation because it cut off, but that's the pre-oxygenation. Therefore, if these two are saying something different, we should pre-oxygenate them. Therefore, B is the right answer. This is the way you answer the question. Now, this is a case study, next generation case study. How are you doing? I put it in the middle this time so that when you going through all these cases, you realize you get a case study to trick you to say, oh, I'm tired. You are not tired. That's what the NCLEX will give you. You see a case study and you start panicking. Don't worry. Take it as one single question and read the question and say, what do I have? 18-year-old female present to the clinic with a mother. The mother reports that her daughter has been skipping meals, counting calories obsessively, and exercising excessively for the past 6 months. The client appears thin, pale, and fatigued. The client reports feeling in control only when I restrict food. These are the vitals. Temperature 97, blood pressure 88/56, heart rate 48, respiratory of 18, BMI of 18. Patient appears thin, pale, and fatigued. Abdomen is soft, non-tender. Lung is clear, S1, S2 present. Patient has low potassium, low albumin, and elevated BUN. Put all these things together. What do you see? As you read case study, go back again. Focus on the first two sentences. 18 years old, came in with the mother. Mother is complaining about what? He's counting meal. He's not eating, exercising excessively. There should few things that should come to your mind that this is what? Eating disorder. What kind? Is it BMI? Is it anorexia or bulimia? That's all. And I give you vitals. Is this what you see? That their temperature is slightly low, that their heart rate is low, BMI is low. And then patient has what? Pale skin, fatigue is all consistent with their problem, and low potassium, low albumin. This is all consistent with what? Anorexia nervosa, because of the BMI, because of the vitals, and all the symptoms associated with it. Patient is not eating. Bulimia will eat and they peg. There's nothing in the question telling you this is bulimia. After you figure out what is wrong with the patient, then you answer the question. The next is review the clinical data. Select two data the next should prioritize. Should you prioritize the heart rate, the BMI, thin and pale appearance, skip their meal, or their blood pressure? When it says select two, you should prioritize. That means all of them are bad. But one you should prioritize in the case study is something you can fix. I can't fix the skippy meal. It will take some time. I can fix the way they look, right? I cannot fix the BMI. All is connected. The most important is the heart rate. It's problem. We got to help it. And then their blood pressure, right? These are little things you can approach these kind of questions, right? Next. The potassium is 2.9. Albumin is low, and what? BUN is high. BUN is high because they dehydrated. Low albumin because they're not eating. Potassium is because of the diarrhea, all the things they've been doing. Low potassium is what killed them when they come to the hospital. Which lab work is most concerning? Of course, hypokalemia is dangerous. Now, a client is admitted to the hospital for severe malnutrition, right? We know the patient has malnutrition and the patient is being admitted, right? She's lethargic and refuses to eat. She doesn't want to eat. What is the next priority? Encourage verbalization of body images feeling. That's what you're going to help them. Initiate cardiac monitoring and continuously provide snack every 2 hours and encourage a group therapy. What do you think? Based on the symptoms, she's lethargic and she's refusing to eat. What should you prioritize? Let it talk about their body image, put them on a cardiac monitor, give them some snack, encourage group therapy. What is going to kill this patient? Potassium is 2.9. You need to put them on a cardiac monitor. All these psychological needs is not going to help you. Now, after admission, the client begin nutritional rehabilitation. We start feeding the patient. There's something the NCLEX wanted to know. Take away. When I feed you with anorexia, because of malnutrition, there's certain things I need to do. So write them down. Which intervention is most appropriate during refeeding? That's the key. That's what I want you to take away from this question. Track daily calorie intake, encourage independent planning, monitor electrolyte, provide high-calorie snack immediately. Which answer choice do you lock in? Use your content on anorexia, on eating disorder. This is a mental health issue question. Which one do you think? When I start feeding you, refeeding, I'm worried about refeeding syndrome. The right answer is monitor electrolyte, because you got to monitor potassium, magnesium, calcium, and phosphorus. Those are the dangerous ones. If you don't, they go into refeeding syndrome, cardiac arrest, and they die. Which answer choices are wrong and trapped? You shouldn't give them high calorie right away because they malnourished. You give them half of the calorie they needed. Of course, psychological needs are fine, but they are not that important at this space. Now, during therapy, the client expressed, I feel out of control if I eat more than 50 calories. Now, this is a psychological question. That's what I want you to take away. That's the key. Therefore, my answer choice has to be what? Psychological. Which intervention is most appropriate? Monitor them 1 hour after meal. Does that answer the question? Validate their feeling, encourage discussion with the therapy, give half the needed calorie, encourage general writing. Think about it. They say, if I eat more than 50 calories, I feel bad. It's a psychological question. Which one is a psychological answer? Pick one and let me know. 1-to-1, you're preventing them from purging. That's not what the question is asking. General writing may be good. Giving them half of the calorie does not answer the question. You just basically, okay, you are not addressing the underlying problem. The best thing is a psychological problem. Validate their feeling, and then you get some therapy. Now, this is the pharmacology I love. Eating disorder, psych meds, right? The client is preparing for discharge. Which prescription should the nurse expect? That's all. Which one should you expect? Metafenidate, bupropion, ziprasidone, fluoxetine. What do you think? Patients are about to go home. Which medication are we going to give to the patient? That's all. Which medication should we give to the patient? The key is anorexia. We want them to eat. The key is anorexia. They have bradycardia. You don't want to lower their heart rate anymore, right? Metafenidate is a stimulant. It suppresses your appetite. We can give it to them. Bupropion is also suppresses your appetite. It's atypical antidepressant. They cannot get it. Ziprasidone will prolong your QT, which will make you have more bradycardia. No. Therefore, fluoxetine is an SSRI. We'll let them eat. They gain weight. It treats the depression too. So that's the right answer. How did you do? Go back again. Keep on watching it. Stop the video. Pick your answer. And make sure you get all of the answer right. This is case study. Be prepared for it, whether you like it or not. They're doing what we call rescue thinking. They will put it in the case study and you got to figure it out. Now, what do you see right there? After a workshop of a fall prevention in the clinic, you see we've moved to some safety issue. Which client a new graduate will identify as higher risk for fall? So who is more likely to fall? Select or apply. A client with prosthesis due to the right below knee amputation, a client on tirazosin, a 55-year-old female client, 85-year-old male client, a client on benzodiazepine, a client using assistive ambulatory device. Lock in your answer, stop the video, and then listen to me how I'm going to pick it. Make sure you get your clues before you pick your answer. It's a select or apply. Don't over-select. You heard that before. Now, I know you pick your answer. How many did you pick? It doesn't matter. So far as you are 100% confident, even if you pick one, I'm okay with it. But I know you can pick more than one because this is risk of fall. Who need to fall down? Hey, if you use prosthesis and you have amputation, that's a problem. You may likely to fall. If you take medication, alpha blocker, that can make you orthostatic hypotension, you're likely to fall. Just because you're a female, middle age, doesn't mean you're going to fall. But an old age, not because you're a male, it can be a female or not. The key is old age, you're going to fall. So 85 is old age, whether it's a male or female. If you take benzos, you're going to fall, can make you fall. And if you use cane assisted device, more likely to fall. Now, next generation type of question. I know you got it, so don't worry. We will break it down. And let's provide care for a client with new diagnosis, what? Open angle glaucoma. He has open angle glaucoma, which teaching at discharge is appropriate, not appropriate to ensure safety at home. What do you teach a patient with glaucoma that is supposed to know to prevent injury? What do you think? I have glaucoma. What would I teach you? Ensure large print label for all prescription. Hey, if you have glaucoma, you should wear your prescription appropriate. Remove all throw rags in the house. I don't want you to fall. Therefore, that's appropriate, right? You see, I'm not doing anything. I'm just going by the concept. Increase bright light of light in the house. It's all about fall, right? Use eye drops for 3 months, then stop. Glaucoma, your eye drops is forever. Inappropriate. You may lose your central vision. Glaucoma, you lose your peripheral vision. Inappropriate. Therefore, this is something that you should pay attention to. It's a concept regarding what? Glaucoma. And I know you got it. Okay, that's the way you can go through these questions easily. Same thing. A nurse is caring for a client who is post-knee arthroplasty and ready for discharge, which teaching by the nurse is indicated or not indicated for what? Safety. This is all safety issue. The key concept is I have knee arthroplasty, surgery in my knee, right? They replace my knee because it's a plastic, right? They put something there, right? What do you think I should do in order to help with home safety? Use injectable enoxaparin as needed. Use a wheelchair to assist with ambulation. Install a grab bar in your toilet. Install elevated toilet seats. Take Motrin for cramping pain in the calf. What do you think? Lock in your answer. Is there indicated or not indicated? Use injectable enoxaparin as needed. Yes, we don't want you to get DVT. Use a wheelchair to assist with ambulation. You're not going to use wheelchair. I want you to walk before you leave the hospital. You are not going to go home if you're not walking. Therefore, you can go home with the wheelchair, not indicated. Use a grab bar in your toilet so that you don't fall. It makes sense. You just had surgery on your knee. Elevate toilet seat so that you don't bend too much. That's good. And then what? Take Motrin for cramping pain in your calf. That's a trap. This is anklet trap. What is the biggest problem I'm worrying about this patient? If you have leg surgery, orthopedic surgery is DVT. When you have issue with your calf, cramping pain in your calf, this may be what? Compartment syndrome. Don't take Motrin. Let me know. Otherwise, we have trouble. Therefore, this is not indicated. These are things you will see in this next generation kind of question, metrics question, appropriate, inappropriate. It's a pictorial presentation. You already know the content. A new graduate, file an incident report due to a client fall. Patient fell. A file report. Which component of the report need further teaching? What do you think? How do you file a report? What do you put in the report? And which one need further teaching? Statements were in quotation mark. Is that appropriate? Detailed explanation for the cause of the fall. Name of the witnesses. Intervention administered. When you file a report, what are the things you should put in the report? Lock in your answer. Let me know. But detailed explanation should never be put in because you may say things that are inappropriate. Just write what just happened. Whoever says something, we put you in quotation mark. That's appropriate. You name the witness's name, whatever intervention you apply. When you try to write detailed explanation, you're telling stories. That's no incident report. Need correct intervention. So these are the things. We need factual information. We need subjective data. We need objective, no explanation, the name of the victim, the location. If somebody says something, put in the quotation mark, and then all intervention should be indicated. Nurse is preparing to transfer a client from bed to chair. That's the question. Which two priority factors the nurse should know to utilize the appropriate method for safe transfer? Complete the sentence below. What is the question is asking? I'm going to transfer a patient. What is the strategy to transfer a patient to ensure good transfer? What should I assess? Should I assess their weight? Should I assess if they can bear weight on their leg? What is their medical history? What kind of surgery they have? And then whether the patient can pay attention, they are alert, they can cooperate, or their strength. Write these two things down. There's only two things that you should worry about if you have to transfer a patient. Can their leg touch the ground? Weight bearing. And can they cooperate? If I tell you to jump, jump. If I tell you to sit, sit. If I tell you to lift your leg, do. If they cannot do it, then you know this patient is not safe to transfer. You may have to use a lift. Therefore, this is the right way to do that. Very, very important. Two things to know. And let's perform hold visit to a client with moderate Alzheimer's disease. Which finding is concerning? This is a safety question. Therefore, caregiver look disheveled. Is that good? Caregiver assists with ADL. Caregiver feels tired. The house is disordered, untidy, and difficult to move around. Which one is concerning to you? Right? Is the most concerning. Of course, if the caregiver look disheveled and need respite care, caregiver assists with ADL, that's good. Caregiver feel tired, need respite care, right? This one, cluster. The house is clustered. There's untidiness. This is bad. Problem for safety. Patient may fall. Patient may not be taken care of. We need to pay attention. That one is a big safety issue. I try to be fancy. When you see this question, it's a diagram question. It's a strategy question. Don't panic. And nurse has attended staff education program on fire safety, right? Fire safety. Instead of giving you easy fire information, I give you image and you have to interpret it. Which action should the nurse take first when extinguishing a fire? Is this okay, right? Versus that. Look at it carefully. So that's the patient. Or versus this one. You see the fire going to the base and then squeezing an extinguisher to make sure the extinguisher comes out. So this is the extinguisher is coming out. This is you pulling the pin out. This is where you aim the base of the fire, and this is where you squeeze. What do you think? The right answer is to pull the what? The pin first. You pull the pin, you aim at the base, and then you squeeze, and then you release. That's the way we check, we apply, or we extinguish fire. That's all. That's the content there. Which of the following organisms requires soap and water for effective removal? This is infectious control, infectious prevention, and transmission-based precaution. Select all that apply. And nurse is reviewing infectious prevention practice. Which one requires soap and water? Soap and water. You definitely have to use soap and water for hand hygiene. Clostridium, Bacillus anthrax, norovirus, adenovirus, and rotavirus. If you don't know, this is my favorite question. I want you to take a picture so that when you see next question on infectious control, you don't trap. There's some infectious control that can use alcohol-based hand sanitizers. There's some that you have to wash your hand. If it's a spore-based formation organism, that means they form a spore. That is the key. Clostridium form a spore. Bacillus, right? Anthrax form a spore. You have to wash your hand. Then there's some viruses that are uncoded, and this one is norovirus, adenovirus, and rotavirus. Pay attention, write them down, take a picture every time and look at them and say, these are the things, if they give me any hand hygiene, I got to use soap and water. These 5 are your clue. And this is the most common one they're going to ask you about. So you need the form spore and you have non-envelope virus. Those are the 2. Which of the following infection requires such PPE? Pay attention. A nurse is preparing to care for a client and plan to wear what? N95, gown, and gloves. Which infectious control disease should I wear that? Disseminated varicella, TB, smallpox, influenza, and Clostridium. Lock in your answer. Let me know. You got it, right? Now, before you answer the question, go for the keyword. What is the question asking? Always ask yourself, what am I being asked to do? N95, I know is airborne. Gown and gloves, I know is contact. Therefore, I need airborne and contact. TB is airborne, is eliminated. Influenza is droplets, eliminated. Clostridium is what? Contact, eliminated. This one is airborne and then contact. It can also spread by that. This is also airborne and contact. So A and C are the only one that need airborne contact. That's the way you break these questions. That's the way I want you to think about it. And this is teaching the client prescribe isoniazid, which vitamins may be indicated to prevent or treat side effect of INH. Selected apply. Did you see we did something? We moved to pharmacology. And I'm trying to tell you pharmacology is key. This is a selected apply. You saw what we saw, selected apply. The same thing, SATA. They can give you selected apply where there's only 1 answer, 2 answers, 3 answers, 4 answers, or 5 answers. This is one of them. You're taking isoniazid. What should I give it to you to prevent the side effect? Vitamin B6, vitamin C, vitamin D, folic acid, niacin. What do you think? Of iron isoniazid is peripheral neuropathy. Which medication we give you? B6. I put a bunch of them there. That's not treated, but it's a selected applying to tempt you to pick it. Vitamin C has nothing to do with peripheral neuropathy. Neither is vitamin D. Neither is folic acid. You know, it's anemia. Neither is niacin. The only thing is one answer and one alone. But to test you, NCLEX would do that. There's only one answer. Even though it's selected apply, don't pick it. Which statement by the nurse best describe understanding of the antidote? Pharmacology, nursing pharmacology, NCLEX pharmacology. A nurse is caring for a child with elevated blood lead level. The air care provider prescribe what? Systema, DMCA. Which statement by the nurse demonstrate understanding of the antidote? What do you think? Bind the medication, bind lead in the blood and help excrete it in urine. Systema neutralize what? Lead in the stomach to prevent absorption. The systema increases the metabolism of lead in the liver. Systema is given to reverse acute lead-induced seizures. It's a concept, classic NCLEX. This is the recall. It's either you know it or not. That's all. So if you don't know it, you just write it down. There's no way I can explain it to you. This is a recall type of pharmacology. There's some pharmacology that require recall. While I'm talking, I know you're picking your answer choice. So pick one. Which one? It's the word antidote. Antidote, there's some that neutralize. There's some that bind, that prevents you from absorbing the medication, and some that reverse the effect. For these particular medication, it just binds to lead. It just binds to lead. It's a chelating agent. It binds to lead and prevents you from absorbing it. That's all. So that's the key concept here. That's the thing binding to lead and prevents you from absorbing it. A nurse is providing district teaching to a client who has been prescribed epotin alpha as part of home medication regimen. Which instructions should the nurse include to promote effectiveness of the medication? Take a folic acid daily, take a vitamin C supplement, take vitamin A supplement, take iron supplement. Lock in your answer. Let me know. I put this in the community chat. The score was very low, but I will explain the answers to you, why the right answer is there. Which one is that? Which answer choice do you pick? Which answer choice? I can tell you the right answer is iron. Why? Hypothene is there to increase what? Your blood level. The question is asking you, what is the function of hypothene and what is being used for? I need to increase your hemoglobin. I need iron to make hemoglobin. Well, what do you think? We got to take iron when you take hemoglobin, when you take hypothene, so that it can increase your hemoglobin level. Vitamin A is night blindness. Vitamin C may help with absorption of what? Iron, but it has nothing to do with what? Hypothene. It's indirect. Folic acid is not. Therefore, that's the right answer. So these are strategies that you have to pay attention to. Like I said, vitamin C may increase iron absorption, but not necessarily what you need to take when you take hypothene. You need iron. This is pharmacology. This is also one of my favorites. It's not a hard question. It takes a little bit of content and thinking. It's a form of case study. But don't worry, it's a lot. You have to know what the question is asking you. Break it down. Find the keywords. Then rewrite on your own and look at answer choice if you meet. Which medication should the nurse most likely suspect is causing the problem? That means side effect of the medication. A nurse is caring for a client admitted for what? Maniac behavior, who was started on medication. He has nothing to do with maniac, but you have to know a little bit of reasoning why they're taking the medication. I'm breaking down as we go. 3 days later, the client reports sudden onset of what? Severe epigastric pain. Whatever medication was given causes severe epigastric pain. And now radiating towards the back. What is severe epigastric pain radiating towards the back? Use your med search to make a diagnosis. Now we get the lab to confirm your diagnosis. Amylase level of 1,000, lipase level of 1,000. Which medication does the nurse know is causing this problem? Lithium, carbamazepine, valproic acid, haloperidol. It's a straightforward question. Critical thinking, test-taking strategy. I've broken down the question. Which answer choice do you pick? I know you picked the right answer. The right answer is valproic acid. Why? Why is it valproic acid? Patient has mania. It has nothing to do with it, so don't pick lithium. I said we give the patient certain medication. Medication causes epigastric pain radiating towards the back, confirmed by amylase and lipase. This is what? Pancreatitis. Which medication causes pancreatitis? Lithium does not cause pancreatitis. You know the side effects: seizures, it affects your sodium, it causes hypothyroid symptoms. Carbamazepine, agranulocytosis, it does not. Haloperidol causes NMS and EPS. Valproic acid, one of the common side effects, is what? Pancreatitis. And that's the right answer. It may look really hard, but it's content-based. A nurse is caring for the client prescribed what? INH, we saw it, isoniazid for tuberculosis, which finding required follow-up. Tingling of your fingers, nausea, clay-colored stool, and vomiting. This may be hard, but it's not. It's a tricky question, but it's not. It's designed to let you think so that you know when you see pharmacology, you don't jump the gun. Pick your answer. Select your answer, and let's break down the question. You lock in your answer? You see, I pause, I give you a few seconds. Okay, now let's go. What is the question asking? It said prioritization. Follow-up. It's a prioritization of what? Isoniazid. That means the best way is I need to know the side effect of the medication. What is the common side effect of this? Peripheral neuropathy. Therefore, this is not it's not something I should worry about. It doesn't require follow-up. If you take this medication, you're going to have nausea. I don't need to worry about it. You may vomit associated with that. A clay-colored stool, is what? Bilirubin is high. And that means your liver is affected. Every time they give you TB medication, the most dangerous side effect is when it affects your liver. All the TB medication affects your liver. Therefore, if I see any signs of liver failure, which is clay college 2, that means bilirubin going up. That's my right answer. Go back to this question multiple times, especially this one, to help you understand pharmacology side effect and pharmacology risk reduction. This is the way they ask questions on pharmacology risk reduction. I give you signs and symptoms associated with isoniazid, but there's one when you see it, you know bad thing is happening. Therefore, major complication of liver toxicity is clay college 2. It can also be what? Jaundice, same thing. T-colored urine, all of them. Which condition require postponing? A child is scheduled for what? MMR vaccine. If you have fever, 99.2, cold symptoms, you receive a long-term prednisone, your otitis media. And if you need vaccination, which one should we stop? Which answer choice did you pick? What do you think? I can tell you long-term steroid means immunocompromised. MMR should not be given to a patient who is immunocompromised. Mild fever is acceptable unless you're really, really sick, high fever. 99.2 is not bad. Cold symptoms, yeah, should be given. If you have otitis media, there's nothing to do. You should not stop. Contraindication, major contraindication is immunocompromised. We're on 71, and the questions are not that. We have 10 more questions because of the case study, 10 more questions to end at 80. How are you doing? Stop the video. Once again, if you're tired, go and take some break. Go drink and come back and start on your 71. You don't have to do all the 80 questions or 85 questions in one setting. And I understand that. That's why I said, take a break, come back, take your pen and paper and write things down. And nurse is caring for 4 clients receiving cough medication. Do you know your cough medication? I just did a video on cough medication. All the medication you need to know, the type of medication and side effect is one of the questions. What do you think? Which client should the nurse assess first? Client taking guanfacine with the mild nausea, taking codeine who is drowsy, taking acetaminophen with increased sputum, taking dextromethorphan with hallucination. Which one should you worry about? Guanfacine, you're going to have some nausea. Codeine will make you nausea. Acetaminophen, you have a lot of secretion. That if you see hallucination, that means neurological problem. We are causing too much problem. Therefore, that's a problem, bad problem. And let's prepare to administer acetylcysteine via nebulizer, which action is the most appropriate. Give it, administer with antitussive first, have suction equipment available, restrict fluid, and place the client in the supine position. This is the prioritization position, very, very important. I want you to lock in your answer and come back to this question multiple times because it touched you a lot of information. Which one did you pick? I know you picked the right answer. Now, let's look at it and break it down. What is the question actually asking you? If I'm giving you acetylcysteine, which of these should I prioritize? First, you got to know what is acetylcysteine. It's going to break the mucus, and you're going to have tons of mucus, a lot. And this can cause aspiration. We make these people drink a lot of water. Therefore, restricting fluid is not good. If you have secretion, I want you to get rid of it. Why would I give you something to stop you from coughing it out? Wrong. If you have tons of secretion, you should not lay supine. You're going to aspirate. Have a suction available. This is test-taking strategy, content mastering, and trying to answer questions, thinking about it. Same thing. Which instruction should the nurse include? I'm dealing with what? Respiratory pharmacology here because I think that's very key. These are medication people see and they don't know what to do with them. And then she's teaching a client about guanfacine. Know the function of guanfacine, right? Limit fluid intake while taking this medication. Take this medication at bedtime. Increase oral fluid while taking medication. Dry mouth, report dry mouth immediately. What is the purpose of guanfacine, right? It's an antitussive, right? It's going to help you what? Do what? That's the key. Use that to answer the question and then figure it out. It's different from acetylcysteine that usually will help you, right? Break down a bunch of secretion. What do you think? These medications cannot work without fluid. Therefore, increase your oral fluid. At the same time, if you don't know, there's two things: limit fluid intake and increase oral fluid intake. One of them is the right answer. Always when you answer a question, look for opposite. Therefore, one of them is the best one. The others are expected. Is an expectorant, right? It's going to get rid of your mucus. You need some fluid to help you get rid of it. But I went to the strategy to pick the right answer, even if you don't know. Limit fluid, increase fluid. Just pick one that you know you more than 50% chance. You got to bring your content to answer it. Which condition should the nurse expect? Maternity and newborn. A nurse is caring for a G1 P0 client at 37 weeks who is what? Inactive labor. Client is inactive labor. The nurse notes sustained increase in fetal heart rate from 45 to 180. Which condition should the nurse expect? Opioid administration, umbilical cord prolapse, placenta insufficiency, and maternal fever. If you take in the NCLEX and you see this question, what do you think? Pick your answer. Find the clue. Use the clue to get the answer. Don't just select. I want you to go for the clue in the question and pick an answer. Watch the video. After you pick an answer, click play. What do you think? Let's break down the answer. The right answer is maternal fever. And you can ask why. 37 weeks. I see fetal heart rate. All the question is asking you, fetal tachycardia. That's all. The baby heart rate went up. Sustained, it never came up. Down. Then you ask yourself, opioid administration, if I give you opioid, your heart rate goes down. If you have cord prolapse, baby have bradycardia, right? Heart rate goes down. Placenta insufficiency, baby heart rate goes down. Therefore, the only thing that will happen is maternal fever. Baby heart rate. Fever causes your heart rate to go up. You can see how these questions can be related by going with using key concepts to answer the question. It's a tachycardia problem. Therefore, I'm not going to pick an answer choice that causes deceleration. B and C causes deceleration. Opioid causes another form of bradycardia. Therefore, that's a problem. Which action should the nurse take first? Prioritization, right? A nurse is caring for a 37-week who is in active labor. The fetal heart rate tracing shows variable deceleration. What would you do first? Place the client in the supine position, give the client with IV fluid bolus, initiate amnio infusion, perform a vaginal examination. What do you think? What do you think is the most important in this situation? Lock in your answer and let me know. Guys, the right answer is to what? Perform vaginal examination. Why? Variable deceleration. That's what the question is asking you. And that's the takeaway from this. Variable deceleration, you got to figure out what is causing it. Fred Chopman, right? I know it can be cord compression or what? Fluid problem. You break your, you rupture your memory and you lose fluid and then you have compression of the cord. So these are the two things that can cause that. But how would you know one of them is the problem? They did not tell you there was a memory rupture. So even though amnio infusion is very deceiving, it's a trap. Give them fluid where you want to replace the fluid. Supine position is never good. But you got to confirm, is it cord prolapse or the memory rupture? I need to examine them to make sure there's no cord prolapse. If there's no cord prolapse, then I know this may be amnio infusion that will help because there may be fluid loss. So that's my right answer. Which assessment should be performed first? This is a newborn. And this is teaching new graduate how to assess a newborn. How do you assess a newborn? Temperature, blood pressure, respiratory rate, oxygen saturation. If you have a newborn and you need to assess them, Which one would you do first? There's a concept here. Nursing concept, NCLEX concept, nursing school concept. Take that concept with you. When you examine a newborn, always don't examine something that will cause them to cry. If you can look at a thing and get values from it, that's your answer. Which answer choice you don't even touch the patient and still can get it. Temperature, you got to touch them. Blood pressure, you got to have cough on. Oxygen saturation, you got to put something on. Respiratory rate, you can count the baby respiratory rate, and it's easy, less invasive, very less stimulating. This is a fundamentals physical assessment under what? Newborn. 4 more questions. What is the most appropriate nursing action? A newborn assessment. The nurse note caput secundum, CS, cross suture line. That's the key, cross suture line. Don't worry about it. It's a head trauma. What would you do? Apply ice, notify the healthcare provider, reassess the area during routine care, document the finding as normal, and provide no intervention. What do you think? Which answer choice you lock? When the baby is born, the head can have trauma. There's 2 types. There's a trauma on the scalp. You can have trauma on the scalp that can crosses the suture line, and those that crosses the suture line, that may close one end to another, crosses one end to another. That is capital secundum. And therefore, what do? This is blood. It get reabsorbed. It can make them jaundice. Applying ice is not appropriate action. Healthcare provider is not an agency. I think you should reassess the area and make sure it's getting reabsorbed, because this is non-trauma. It's not the normal finding. It's abnormal, but it's not going to kill the kid. Therefore, reassess the area. And this is caring for a client experiencing delirium tremor. This is mental health. I put it to the last, mental health concept. And I focus on alcohol, because this is what somebody told me. They've been getting alcohol questions. Alcohol questions are very, very difficult, and I want you to understand them. They can be tricky, but they are easy to understand. So, a nurse is assessing the client. It's a substance abuse question. Experiencing DT due to alcohol withdrawal. Which signs and symptoms are consistent with this condition? Select or apply. The key word is what? Delirium tremor. Which one should you expect? Auditory hallucination, tremor, hypothermia, agitation, hypotension, and delusion. What do you think? What do you think? Think about it. Do you know anything about alcohol? I have videos on YouTube. You can check my YouTube site and type alcohol. A bunch of questions will come in. You have a case study, you have this, and then you have key concepts you need to know for alcohol. Delirium tremor is everything going to go up. They're going to have seizures. They will have hallucination, but not auditory. It's tactile. If you see auditory hallucination, it's schizophrenia. That's the difference between this kind of hallucination. Alcohol hallucination is mostly what? Tactile. So this is wrong. Hey, I told you things goes up. Tremor, they will be shaking. Their temperature goes up. So hypothermia is wrong. Agitation, things are going to go up. Hypertension, no hypo, this is down. They don't have delusion, right? This is not psychotic delusional issue like schizophrenia. So that's not expected. So tactile hallucination, tremor, hypothermia, agitation, hypertension, those are all classic symptoms of DT. Same thing. Based on alcohol, and this is caring for a client who is 24 hours into alcohol withdrawal. He's withdrawing in 24 hours. Which laboratory finding the nurse should anticipate? Select or apply. Hypokalemia, hypomagnesia, hypernatremia, hypophosphatemia, hypercalcemia. If you know anorexia, then you know alcohol. Why? Because patients who are alcoholic, they are more nourished and they look like anorexic patients. What are the lab values that you should see in anorexic patient? Is the same thing you see in alcohol, and that is the traffic question. That is the strategy. Therefore, which one would you pick? Lock in your answer. It's a select or apply. You don't have to pick everything. Let me know which one. Yeah, potassium is going to be low, more nutrition. Magnesium is going to be low. The same thing, more nutrition. Yeah, phosphorus is going to be low. These are electrolytes consistent with that of what? Anorexia. Yeah, calcium is also low. Therefore, these are the lab work you should expect. And this is the thing. Alcohol, low K, low magnesium, low phosphorus. That's NCLEX takeaway. Take away this. This is the concept. And then you made it. 80 questions by a total of 85 because of one case study. And your last question is this. What do you think? The client is admitted with community-acquired pneumonia. During intake, the client reports what? Drinking 1 pack of beer every night. The last alcohol drink was 12 hours ago. 6 hours to 12 hours, delirium tremor. That is the NCLEX takeaway from this question. This should tell you, delirium tremor. Which order should the nurse prioritize? This is key. If you don't break it down like that, you're going to miss the point. I know you have problem. I know you have pneumonia, but what is the problem? You are in danger of getting DT. Therefore, the order you should prioritize, make sure you're picking an answer choice about DT, delirium tremor. This is the way you should break down the question because you will overselect and lose a point. Which answer choice is talking about delirium tremor? That is delirium tremor. Seizure precaution, delirium tremor. What else? What answer choice do you think is going to help with delirium tremor? Schedule B1 timing supplement is not helping with delirium tremor. It's just helping with what? If you have to feed them. Encourage oral intake is a problem. Because of the patient condition, they are going to go in DT. Starting IV antibiotic is for the pneumonia. I said, which one you should prioritize? This is okay. This is okay. But to prioritize in this situation based on a scenario, 2 things that is going to treat delirium tremor. That is A and C. This is adapt NCLEX, NCLEX practice questions, NCLEX questions and answers, NCLEX review questions and answers for nursing students, and the NCLEX. How did you do? What was your score? Thank you for sticking around. Thank you for watching. If you like this video, put a little bit of comment so that we can grow this channel. And tell me which questions was hard for you and what you've mastered. Take care of yourself. Good luck and Happy New Year.